Boa tarde, pessoal. Tudo bom com vocês? Sejam muito bem-vindos à nossa palestra de hoje. Meu nome é Daniela e eu sou auxiliar de eventos do GES. E eu estarei junto com vocês no decorrer dessa palestra. Primeiramente, eu queria agradecer a doutora Gilbert e todos vocês aqui presentes. E antes de começar, eu vou dar alguns avisos, tá? Eu vou pedir para que todas as questões que vocês tiverem, dúvidas, vocês guardem, anotem elas, porque a gente vai abrir uma caixinha de perguntas no nosso Instagram, que é @gesuan, e aí nós vamos enviar todas as perguntas para a palestrante, para ela poder responder para a gente depois, tá bom? Eu também gostaria de lembrá-los que a nossa palestra ela vai acontecer quinta que vem, e ela vai ser a nossa última palestra do módulo de março, em homenagem às mulheres, e ela vai chamar Desafios da Mulher dentro da Medicina Veterinária em Animais Silvestres versus Maternidade, que vai ser ministrada pela doutora Mel, tá? Bom, e agora, por último, antes da gente começar, eu vou apresentar a doutora. Ela é a doutora Gilbert, nascida no Texas, e ela é médica veterinária formada pela Universidade de St. George e teve o seu ano clínico na Universidade de Illinois. Ela fez estágio com pequenos animais no Angel Animals Medical Center e com animais selvagens na Gulf Coast Veterinary Specialists e de vida selvagem no National Wildlife Center of Canada. E atualmente ela está concluindo a residência de mamíferos exóticos em Indiana. Bom, dados os recados, então vamos começar.
Hello, everyone. My name is Dr. Sarah Gilbert. Thank you so much for asking me to come and speak with you today. I am currently an exotic companion mammal resident in the US, and I just wanted to give this chat about a few of the species that we see fairly regularly. So I'm going to be talking about sugar gliders, hedgehogs, and ferrets today. So just to give us a little bit of a roadmap of what we're going to be talking about today, for each species, we're going to talk a little bit about their natural history, so how they were in the wild before they were domesticated, what their husbandry considerations are in captivity, how to perform a physical exam, and what to keep an eye on for each species, and then the common diseases we see in each. So to start us off, our sugar gliders, which are also known as Petaurus breviceps. Some important points about sugar gliders. The first one being that they are nocturnal, meaning that they're active at night. This is a common issue with people who don't realize it when they first get these creatures, that they're not going to be interested in interacting during the day. It's good to advise owners that if they want to interact with the sugar gliders, which is encouraged, then they should try to interact in the evening rather than first thing in the morning. They are also arboreal, meaning that they're mostly tree dwelling. And that means they're going to want to be in high places. That's also something to keep in mind when it comes to their enclosures, which we'll talk about a little bit later. They are very social animals. So in the wild, they live in colonies, usually between 6 and 10 adults. So in that picture before, you probably noticed that it's a big group of them. And it's not recommended that they live alone. So people who are looking to adopt sugar gliders should consider adopting a group. That being said, just because they are social doesn't mean that they like new animals. So any time that you're introducing a new animal, you should go very slowly and be very careful. These guys are also marsupials, probably the most common marsupial we see as a pet. So that also leads to a lot of very specific and unique characteristics anatomically that we'll talk about a little bit more. Their captive lifespan usually goes between 10 and 12 years. And then they do have a behavior I want to talk about a little bit called torpor. So torpor is kind of a semi-hibernation state where they get very quiet. They're not very responsive. It's usually due to low environmental temperature, or in the wild, it can happen when the resources are very low. So just something to keep in mind. A client may call you in a panic and say, "Oh my gosh, my sugar glider isn't responding. It's in shock." Advise that owner to one, bring it in for evaluation because lots of things can look that way, but two, to give heat support if, especially in a cold environment. Here in Indiana, we've been having very cold days, and that can certainly be a risk factor for this. So following on that idea of torpor, the enclosure should be kept between 65 to 90 degrees Fahrenheit, and that should prevent torpor from occurring. Sometimes you do need to provide heat lamps if it's getting particularly cold in the area of the house they're being kept. The enclosure should also be large enough to allow gliding. So it should be quite tall and fairly wide so that they have to jump between sides of the cage, and that'll help encourage that natural behavior. And even in big groups of sugar gliders who are getting along well, it's very important to provide enough nest boxes that each adult has their own individual nest box. That should help prevent some of the infighting, and then line those boxes with pouches and fleeces. These guys really like to snuggle down and get into pouches. Just be really careful that nothing has loose strings that can become wrapped around feet or toes and cause constriction injuries. We're going to talk a little bit about diet in captivity, which, to be completely honest, is a very contested part of sugar glider husbandry. There are a few schools of thought, and the biggest thing is that in the wild, their diet consists of saps, gums, nectar, pollen, insects, arachnids. It's just not a very easy diet to replicate in captivity. We don't have access to the kind of gums that come off of trees in Australia in the local grocery store. So, like I said, lots of schools of thought. For simplicity, I am going to talk about a commercial based diet, but there are homemade diets out there. They're not necessarily wrong. Just make sure your owners are getting their information from good sources. So, if you're going to do a commercial based diet, the first thing we have to remember is that these guys are insectivorous omnivores. So, very strange diet. Their gut's a little bit different. And if we're going to do the commercial diet, it needs to be 75% sugar glider pellet, 25% fruits and veggies, and then 5% treats. The big things to remember are that those fruits and veggies, they have to be pretty finely chopped and pretty well mixed with the pellet. And the reason for that is to prevent the sugar glider from just picking out what it wants and not eating what it needs. So they will preferentially eat fruit over pretty much anything else, and that can lead to problems down the road. The 5% treats, what we typically recommend is a mealworms, other insects. The reason why we consider these treats is because in captivity, these insects are not well balanced. So the ones that we're breeding to feed to these animals are not going to be the same nutritional profile as the ones that they would eat in the wild. So you do have to be careful, even though they are insectivorous, they can't have a diet that's just insects that are bred captively. Here's just to give an example of a couple of the commercial diets that are available. The Wambaroo is a brand that's based in Australia, and it's mostly there as a supplement to people who are feeding like sap and gum diets to make sure that the sugar gliders are getting enough protein, because that's what those diets are mainly deficient in. And then the Missouri is an American brand that provides balanced nutrition for zoo animals. So the Missouri insectivore diet is a pretty decent approximation of what they need when you're feeding it with veggies and fruits and insects as well. Now that we have some of our basic husbandry out of the way, I want to talk a little bit about performing a physical exam on these guys. They do have some very unique anatomical characteristics. So you may have noticed they have a patagium, and that's that skin flap that goes from the front feet to the back feet that allows them to glide. They are marsupials, so they do have a pouch where the young grow up, very similar to kangaroos and opossums. And then they have these scent glands, which we'll see a picture of here in a second. But the most prominent one is on the head of males, but it doesn't show up until they become sexually mature. So frequently owners will call and say, oh my gosh, my sugar glider just went bald. What is happening? That is not a pathologic finding. That is very normal, but it's something that gets confused a lot for something that shouldn't be there. And we'll see a picture of it. And then the last thing is, as a marsupial, they do have a cloaca, and it is a little bit hard to find the rectum. So when you're taking a temperature on these guys, it's generally a cloacal temperature and not a rectal temperature. Over here, I did list a few of their regular values. So for heart rate, obviously gets quite high because they are quite small. respiratory rate, rectal temperature, and cloacal temperature. So as promised, here are some pictures. So that's that scent gland we were talking about on the head of the males. It can be a little bit smaller, but typically that's what it looks like. And then additionally, you have the scent gland up here on the top left. They do have one on their chest, and then there'd be another one paracloacally. But the one on the head is the one that owners usually can see and then get caught up on and concerned about. And then this picture on the right, you can see the patagium is there. So it does extend kind of from here to here and then from here to here. You really want to pay attention to that because it can get injured and just focus on, does it have any tears? Is it shortened? Anything like that can affect mobility. The other thing I do want to point out in this picture is this is actually the scrotum in males, and it is affectionately called a palm among the sugar glider community, but it looks a little bit different than other species. It's pretty cranial compared to other species, so I just wanted to point that out. So that being said, we've kind of discussed everything as far as what to look for in a physical, but how do you do a physical? Because these guys are quite small and they can be quite fractious. So we're going to talk a little bit about sedative protocols and blood sampling. Sedation can be a really important part of physical exam in these guys because, as we said, they can be quite fractious, and getting a good oral exam on a small animal is very difficult when they're awake. So the sedation protocol that we generally use for a otherwise healthy young animal with no known comorbidities is the protocol I've listed out here. So we do use a multimodal protocol. And the reason we do that is because it allows us to use very low drug doses and also to provide pain control or whatever else we might need. So we generally use midazolam, butorphanol, ketamine, and alfaxalone at those listed doses. We give the midazolam, butorphanol, and ketamine in a single syringe and then add on the alfaxalone if needed. It used to be that it was recommended that we gas down all of our sugar gliders, put them in a little box, run in some ISO, and let them go to sleep. But that is a very stressful way to sedate something. We can see them. They tend to vomit. They have a lot of hypersalivation. It's just not nice. And in this way, you can give them their pre-medication, you can take away that stress. And then if you do need to top them off with isoflurane, it's going to be a lot less stressful for them at that point and a lot less wasted gas for your team and for resources. If you need to do a venipuncture, you should always do it sedated because you are going to want to use the cranial vena cava and the jugular. Of course, the risk of a cranial vena cava is going a little bit too far and hitting the atria. So you do want to be careful and you don't want them jumping around while you're attempting to do that. The other last reminder I would give is these guys are small. They get cold very easily. So when you're sedating them, you need to make sure that you are keeping them on heat support and supporting them until they are able to thermoregulate on their own. Okay, so we know how to do our physical exam, we know how to get our samples. Now we're going to talk about some of the common disease presentations we see, what they look like, and how to treat them. Unfortunately, one of the biggest things we see for sugar gliders is self-mutilation. So this can happen for a variety of reasons. It's exceedingly common in single intact males that they will mutilate their own penis and scrotum. This is thought to be secondary to social frustration, sexual frustration. They will actually just go in and bite themselves. So they'll come to you often with a necrotic penis, the scrotum is bleeding, all of that. And often they will be in need of amputation of those necrotic tissues. The good news is, and I'm going to go through this picture here in a second, that they have a bifurcated penis. So you can see here, it's got kind of one piece, two piece, and the urethra is actually up here in this base area. So you can see the catheters in the urethra. So luckily we can uh, amputate pieces of this. You can see this is kind of necrotic there. You could take that off and this is kind of necrotic without affecting that animal's ability to urinate. That being said, if you do have to go so far as amputating the penis, it is strongly recommended that you also neuter. Neutering seems to kind of calm things down and they don't want to go after themselves quite as much. The other reason why this is important is because Anything that bothers the sugar glider will chew. So this becomes particularly important after surgical procedures. So if there's any reason that you've had to go into a sugar glider, you've had to perform a spay, you've had to do a mass removal, anything like that, it's very important to one, bury your sutures, and two, make bandages. Because as long as there are sutures, as long as it's itchy, as long as it's painful, they are going to go after it and tear that incision open again and cause themselves more and more damage. This is an example of a vest that was made to protect a surgical site so that the sugar glider was not tempted to tear out all of its sutures. The other big thing you want to think about besides bandaging is pain control. If the pain control is inadequate, then the sugar glider will go after the incision. And so if you have adequate pain control and adequate coverage, you should be able to get them through the recovery period without too much trouble. The next disease I want to talk about is nutritional secondary hyperparathyroidism, which used to be known by the name metabolic bone disease. So the etiology is when the diet is deficient in calcium, and our sugar gliders, that's generally seen in fruit-based diets. Our clinical signs are very similar to other species with hypocalcemia. It can start with lethargy, muscle tremors, and progress to seizures if it gets severe enough. Diagnosis is often done on history and clinical signs based on, that's why it's so important to get a thorough diet history. And you have to be careful because owners will say, well, I give fruit and other things. But remember that these guys will preferentially eat fruit. So if they're not mixing it or if they're not, using it more as a treat and making them eat the other things, the sugar glider could just be eating fruit, even though the owner is offering everything. You can choose to run an ionized calcium, which can be useful if you need to figure out exactly how much you need to supplement, because it is possible that they might be very, very low and they may need long-term supplementation. Treatment is generally diet adjustment, so you do have to get the owner on board with that and making sure that they're feeding appropriately. And then, like we talked about, if your ionized calcium is indicating that your calcium is very low, or if you're having seizures, then you may need oral or injectable calcium supplementation, depending on how bad off they are. The last sugar glider disease I'm going to go over is dental disease. It's something we didn't used to see, but we are seeing more and more as time progresses. I did provide you guys with the dental formula. On an earlier slide, you did see the full dentistry, but the big thing here is that the only predisposing factor that we have identified is a soft carb rich diet. So again, we're coming back to if they are eating a lot of fruit, it's going to cause a lot of issues for them. It may even get to the point where you actually have to extract teeth. So the picture here, you can actually see this is a dental abscess that has ruptured through the face, and those teeth did have to be removed because of all of the infection at the tooth root. The only kind of caution to that is that, unlike a lot of our species that we work with in exotics, these guys do not have open roots in their bottom incisors, their mandibular incisors. So if those are having a problem, you cannot trim them. They will not grow back, but you can extract other teeth around them. And if those do need to be extracted, they can, because this can progress to osteomyelitis. And I'm actually going to show you a cool picture of that in a second. So this is actually a CT we did recently of one of our patients who has had long-term dental disease. And as you can see right here, she actually has a bony outcropping where the infection got so bad, the osteomyelitis caused proliferative lesion. So this can cause serious issues for these guys, and it's something to keep an eye on. So just a reminder that even if you could do kind of an exam with them awake, it's always worth getting permission to sedate them and getting that full oral exam in when they come in for their yearly visit. So now that we've gotten through sugar gliders, we are going to move on and discuss hedgehogs, Adalarix albaventris, and start off with some of their husbandry and some of what's particular to them. Similar to the sugar gliders, these guys are also going to be nocturnal, so they're really only going to be active at night, not being particularly interested in hanging out with you during the day, probably going to be hiding and sleeping for most of it. Unlike sugar gliders, these guys are solitary. So in the wild, they are only together for mating and for raising young. So hedgehogs do not want friends. It is not recommended to house them together, and they should be kept separate. Their captive lifespan does range between 4 to 6 years. A couple of hedgehogs have gotten up to 8, but that is very uncommon. And then the last thing I want to talk about is a behavior called anointing. So, anointing is particularly common in young hedgehogs because it's something they do when they encounter a new scent. So, when they're young, they're encountering lots of new things and it's all very interesting. It's thought that they do it so that they can smell more like their own environment and they blend in a little better. And so, what it actually is in this picture over here to the right, you can see there's like really foamy stuff coming off this hedgehog's tongue. So when they smell something really interesting, they create this very foamy saliva, lick, 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 and then spread that saliva all over their own quills. And that is to get that smell on themselves. But it can look a lot like a seizure. So if an owner calls and says that their hedgehog is seizing, it's foaming at the mouth, you might want to keep this in the back of your head as a possibility for what's actually going on.
Their husbandry is a little bit simpler than the sugar gliders. Their enclosure, they should stay between 72 and 90 degrees. These guys can also experience torpor. It just takes a little bit more for it to happen in them. They are generally very active, so they should have a nice big enclosure that they can move around quite a lot in. They often appreciate having little running wheels like mice and hamsters. Just make sure that it's a complete one so it doesn't have holes in it for their little feet to get stuck in. They should be provided with substrate for digging, so some kind of dirt or something soft. That's a very natural behavior for them, and it'll keep them from getting too bored. They also very much need a hiding spot. It can be anything from, a little igloo like we have for guinea pigs to a little nest box, just something they can get into where they are not visible and they can feel safe. Their diet is a lot easier. They are insectivores, but again, we come to that idea that the insects that we are raising in captivity are not going to be balanced. And so they are going to have to go on a commercial hedgehog diet for the vast majority of it. So the one that we usually recommend is Missouri. Again, it's that brand in the US that supplies for the zoos and it's just has all the research behind it. So easy one to recommend to new owners. We do say that they can have a small amount of fruit and veggies mixed. Again, chop it up nice and fine so they can't pick and choose what they're eating. And then live insects as a treat are a good idea, but it is recommended that you gut load them before offering.
Physical exam in these guys can be a bit of a challenge, as I'm sure you've no doubt guessed. They do have a very particular anatomical difference, which is their big mantle, which is very fatty, and then the keratin spines along their back or quills. So, good thing to note is that the quills should be very firmly attached to the skin. If they're coming off easily, then that can be a sign of a problem. But they are also very sharp, and these guys will use them to defend themselves. A healthy hedgehog can roll all the way up, get their feet and their face and nose tucked in, and you won't be able to see anything. And they will jump and make a lot of noise and try to scare you off while they're trying to poke you. So we will talk a little bit about how to get around that. But really quickly, I just want to talk about what looks normal before you move into things like sedation to help you get your full exam done. So there are normal gaps between their incisors. They're not missing teeth. Those gaps are actually made to fit insects in between and then crush them. And then the other thing to think about is these guys can get a lot of neural issues, and their physical and neuro exam can be quite challenging because once you've given a sedative, then your neurologic findings aren't really reliable anymore. So there is a really nice paper from Dr. Doss that I won't go too much into right now, but he's kind of the hedgehog guru at the University of Wisconsin, and he did a really great review of how to get a awake neurologic exam and what normal looks like. On the right here, I've also provided the normal parameters for these guys: heart rate, respiratory rate, and temperature. It is worth noting that they do tend to run much colder than everybody else. So just keep that in mind when you're triaging them.
So this is the example of the gap between the incisors. So you see there's a gap here and then not, they kind of fit in here, and that's for crushing bugs. They get them in here, they crush them with these two. So very normal. There are no missing teeth in this picture. And then this is also an example of how to handle these guys. So you can see it's called scruffing. It's a little bit similar to a cat, but you can really only do this in either a very docile hedgehog or one that is already sedated. But that does help keep them open so that you can do things like a scald their chest and palpate their abdomen. Even with friendly hedgehogs, sedation is basically a must for any level of full physical exam or if you need to do venipuncture. So, what we generally recommend, and again, this is a Dr. Doss paper because he is the hedgehog guy. We do midazolam at a mg per kg and alfaxolone at 3 mgs per kg. The really great thing about this protocol is it can go intramantle. So if you do have a hedgehog who is wrapped in a ball that you can't get to, you can just put this in anywhere you can get into the mantle. So very easy protocol to get into these guys. They do tend to go down really quickly. So it takes about 10 to 15 minutes to kick in. You usually get about 15 to 20 minutes of good sedation where you can get x-rays, you can get blood work, you can get that full abdominal palpation and that good oral exam. And then they usually wake up without an issue. The only downside to this protocol is they do tend to get very hypothermic. So you need to have a heat support on board prior to sedation, during sedation, and during recovery. And you need to be monitoring their temperatures pretty frequently. There will come a point where they are too awake to tolerate temperatures, and that's usually where they're okay enough that they're thermoregulating fairly well on their own. Uh, a note about this, we do strongly recommend injectable protocols. Some people will still kind of trap them under a dog sized face cone and pump ISO in that way. Again, it's very stressful for them, and we really are trying to get away from it. This protocol is very straightforward, very simple, and works really well. So there's really not a reason to gas them down. And then venipuncture sites, if you need to do that, are very similar to the sugar gliders. Recently, people have been talking about doing jugulars in these guys. It's a slightly different technique where you come down perpendicular to the body rather than going up underneath the thoracic inlet. And the reason for that is that their heart is very close to the thoracic inlet, so they're at a higher risk of puncturing the atria if you're trying to use the cranial vena cava. So just something to keep in mind as you're getting your samples. We've learned how to do a full physical exam and how to avoid getting injured while attempting to do it. So now we're going to move on to common disease presentations and what we do about them. The first disease we're going to talk about is ascariasis, which is the fancy doctor word for mite infestation. So the most common one we see in hedgehogs is Caparina tripolis, and that is pictured there to the right. Uh, Very common to see. Some of them may have it and never be clinical, and sometimes they needed to be treated. So our giant clinical signs are quill loss and hyperkeratosis. So again, if your quills are falling out really easily, then you should go looking for a cause. We diagnose it very similarly to how we do in cats and dogs, which is just a skin scrape and then look at it under oil. And this is what you're going to see is these round guys. They look a little bit like Demodex in my opinion, so easy to recognize. And then the treatment is pretty straightforward. We tend to use selamectin. It's topical, easy to use, but ivermectin also has dosing protocols for this particular disease. And then, of course, owners need to know that they have to treat the environment. If they don't get the environment clean, they're going to be back with you in a few weeks when those new eggs hatch, and you're going to be having to do this entire process over again. Unfortunately, the biggest thing that hedgehogs are known for is for making cancers. So, one of the very common ones we see is actually uterine neoplasia, obviously only found in females. But typically, these guys present because they're having bloody urine at home. They could be lethargic. They may not be eating as much. You may also note weight loss. If these guys have been coming to you regularly, they may show that in their weight history. Diagnosis is generally done on radiographs and ultrasound. Radiographs are helpful because there are other causes of hematuria. So these guys can make bladder stones. It's not as common as it is in some of our other species, but it does happen and it's worth ruling out. Uh, Ultrasound also very good because you can see where your fluid pockets are and all of that. The treatment of choice is ovariohysterectomy. So you do want to go in and take those out as soon as possible. Some of these guys can be anemic if the amount of blood they're passing gets large enough. So this here is just an example of a uterus that was removed due to uterine neoplasia. It's very large because it's full of fluid. So you can see they do have two horns here and then a single body. And hopefully they don't have any metastasis, but this will at least keep them from bleeding out. The other cancer I do want to talk about specifically is oral squamous cell carcinoma. This one is very common in these guys, unfortunately. Their biggest clinical signs are going to be swelling of the gingiva and then loose or missing teeth. Sometimes owners will also report that they're not eating as well because they're uncomfortable. There's blood coming from the mouth. In this picture here, you can see that this jaw does not close all the way, and that's because of this lump here, which did turn out to be a squamous cell carcinoma. Unfortunately, this doesn't come with a very good prognosis. Certainly, you can go through your diagnosis process, so get your fine needle aspirate and cytology, get your biopsies, and see what's going on. But treatment is generally palliative. There's not a lot to do here because of the fact that these are so locally infiltrative, um, and they just cause a lot of issues and they make it to where the animal doesn't want to eat and it severely affects quality of life, and they are malignant tumors. So, unfortunately, once you find this one, it is mostly about keeping the animal comfortable for as long as possible. To wrap up with hedgehogs, we're going to talk about hind limb ataxia. So, this is a very common presentation and it has kind of two distinct reasons for occurring. So, one of them being wobbly hedgehog syndrome, and the other one being intervertebral disc disease. And at the beginning of these disease processes, they can look extremely similar, but they generally have very different outcomes. So, I just want to go over how to tell them apart and how to go through it with the owners and what to expect from them. So, wobbly hedgehog syndrome is a demyelination. So, the nerves in the back end start to lose their myelination, they can't talk to each other, and it actually has an ascending progression. So it typically starts off as hind limb ataxia that might be intermittent. It might be there one day, gone the next, but it does progress over time until the hedgehog can no longer move. And that's the point where it becomes a problem. So we usually recommend euthanasia at the time that they become immobile, which is about 18 to 25 months after the initial onset of clinical signs. And unfortunately, we don't have a good way to treat this. And it does happen in younger hedgehogs. So, usually before the age of 2 is when this is going to present. So it's a very sad disease to treat, very sad disease to talk to owners about. And it is very difficult to get a definitive diagnosis. We actually don't have a way to diagnose it ante-mortem yet. Usually it is diagnosed post-mortem and they do it on histopathology where they see the demyelination of those nerves. So the other thing we want to talk about is intervertebral disc disease, which can also cause hind limb ataxia. The big differences between this and wobbly hedgehog syndrome are age of onset. So typically we do see them affected much older, so between 4 to 6 years of age, possibly a little bit younger, but not as young as wobbly hedgehog syndrome. It usually presents as a chronic and progressive ataxia. So you're not going to have those intermittent clinical signs where one day they're completely lame and then the next day they're feeling much better. So it's going to look a lot more like in cats and dogs when they get back issues, where maybe you see it get better, but it's not going to be completely better from one day to the next. And then you may be able to see this on x ray. So you may see spondylosis, you may see calcification of the spinal cord, you may actually see a step where the spinal cord is getting crushed, but it's a little bit iffy. The way you'd really want to diagnose intervertebral disc disease is just like cats and dogs. You would want to get an MRI, and that's usually not feasible in these tiny guys. So the way we manage this, because it is less of a death sentence than the wobbly hedgehog syndrome, is very similar to cats and dogs. So you're going to recommend cage rest, you're going to recommend anti-inflammatory treatment, pain medication, all of those normal things. You're going to want to take away their wheel if they have one, keep their enclosure kind of small, and keep food and water readily available so they have to move as little as possible for several weeks. And on the next slide, I'm going to go over a little bit of how to do a hospital cage setup. This is a screenshot from one of the videos from our clinic that talks about taking care of pets at home. This is obviously a rabbit, but it does have a lot of the principles I do want to discuss as far as setting up a hospital cage for a hedgehog with hind limb ataxia. So you can see there's not a lot of space for as big as this rabbit is. You really only want enough that they can turn around and be comfortable. You don't want to encourage them to run from one side of the cage to the other. The other thing is that here the litter box is actually cut down so he doesn't have to step over it. So if you have an animal who's using a litter box, making it like this to where they can just walk in will encourage them to continue to use it and not cause a mess and cause issues with recumbency care. So getting urine scalding, fecal staining, all of that. And that is just a nice way to keep them contained and keep them still comfortable. You can still provide their hiding place for hedgehogs. They are going to want that to keep them low stress. But listed below is also the link to this video. This is just a screenshot, but we do have a full video on how to take care of pets who may need additional nursing care at home. And I just find it really helpful to give clients kind of tips and tricks on how they should be doing this. We are on to our last species, which I was told is not a very common one to see in Brazil. So we are going to look at ferrets, which are Mustela putorius burro. That's the domestic species. There are a few wild species, but we are not going to be talking about them today. But they are very cute and they do have a very interesting conservation story in the US. If you ever want to look into it, look into the black-footed ferrets. Because we do have a fully domesticated species of ferret, their husbandry is a little bit easier than the sugar gliders and hedgehogs we talked about, where we have a difficult time replicating their diet and captivity and getting everything that they need. The big thing for these guys is their enclosure. So they are very active, very curious, very interactive creatures. So you need a pretty good sized cage. It needs to have very good ventilation, but also be a little bit escape proof. So they do need very small bar spaces within 1 inch if you are going to have bars. And that is because of the way they're built. They can get out of almost anything if it's more than an inch. It's very impressive what they are able to escape from, so I would not test them. Just make sure that you are able to keep them contained. They do like to have dark sleeping areas, so if you provide towels and fleeces, things for them to get under, they will cuddle under anything like it's a blanket, and they usually sleep in a tight wheel. uh, these guys can also be trained to use a litter box, so that should be provided in their enclosure. And these guys are very social, so they will very happily live in a group. And a group of ferrets, cutely enough, is referred to as a business. So, moving on, again, these guys are a little bit easier in all of their husbandry, and their diet is no different. There are a variety of ferret pellets available on the market. We do generally recommend either the Missouri or the Oxbow. Marshall's, which is the big breeder of ferrets in the US, also has some diets which are fine, but we don't like them as well as the Missouri and the Oxbow for these guys. There is some argument going on that they are built to eat whole prey items. Some owners will feed raw diets, but that does come with zoonotic risk of salmonella, campylobacter, that kind of thing. So just keep that in mind when you're taking husbandry information that might come up. It's not necessarily wrong, but it does seem like a bit of a risk. People do recommend giving like mice pinkies and things like that as treats, but you do want to give the entire prey item if you're feeding a meat diet so that they're not getting an imbalance of anything. Generally speaking, if your owners are insistent on feeding a homemade diet with live prey and all of that, then the composition should be about 30 to 35% protein on a dry matter basis and about 15 to 20% fat on a dry matter basis. Physical exam is a little bit easier in ferrets than it was in the two species we just discussed. They're a little bit more like cats and dogs. They're very amenable to handling generally, but they are pretty wild. When you go to look at them, they're going to want to run around. They're going to want to sniff everything, eat your shoe if they're on the floor. Pretty much anything they can get into, they're going to want to. The nice thing is that they are very amenable to scruffing. It's not stressful for them. It makes it very easy to handle them. You can get in your auscultation, your abdominal palpation, and everything pretty easily. Typically, when you scruff them, they also yawn, so you can get a really good look at their oral cavity without having to fight with them. So, very nice tool. And it's generally going to be the same as our cats and our dogs. So their heart rate's a little bit higher, but their temperature is about the same. The respiratory rate's about the same. When you listen for the heart, it is going to be a little lower in the rib cage than you might expect from cats or dogs. But other than that, it's all about the same. The only other anatomical difference I would point out is that sometimes their spleens are large, and that is normal and that is okay. If it's causing a problem or if an animal is sick and has a large spleen, it may be worth investigating. But generally speaking, we don't worry too much about large spleens in these guys. They do tend to make a lot of red blood cells in places that aren't the bone marrow. Our venipuncture is pretty much the only time that we sedate them if we're doing an exam. Some of them don't require sedation, even when you're doing a cranial vena cava, because the heart is very safely away from the thoracic inlet. But some of these guys will not tolerate blood draw without sedation, and you can usually get away with just a little whiff of butorphanol and get it done pretty quickly. The general life expectancy is between 6 to 8 years, and usually around 6, I would say, is where we start seeing problems, but 8 years is quite old. Uh, Vaccinations, these are almost the only species that we see that gets normal vaccinations. So they should get an annual rabies vaccine and they should be vaccinated for canine distemper. They are very susceptible and it does cause serious illness and often death in these guys. In the US, we actually had a recent outbreak and it caused quite a problem. So just something to keep in mind that if you are seeing them regularly, they should be vaccinated on an annual basis. Here's an example of scruffing. So again, not a stressful procedure in these guys. It works very much like a cat. You just collect the skin at the nape of the neck, and they are happy to just hang and let you do whatever it is you need to do to them. And then here is an example of getting a blood draw from the cranial vena cava. It's pretty similar to other species in which we use the cranial vena cava. So you're going to use the point of the shoulder and the manubrium as your landmarks and kind of go in between. So nothing too different about these guys in that sense. Moving on, we're going to cover some of the common diseases that we see in these guys. There are a lot of things that we could talk about. I chose to focus on the things that you might see them for on an emergency basis. So things that will need to be addressed immediately rather than things that may become chronic or that we see as they age. So this is not an exhaustive list. I could probably do an entire hour just on ferrets, but this is kind of a quick rundown of what you might need to be aware of if you are seeing them at your clinic. One of the most common things we see in ferrets is gastrointestinal foreign body. So, like we talked about before, these guys are extremely active and extremely curious. And for some reason, they really like to eat rubber and they really like to eat foam. So, a typical history for these guys is a young ferret, usually between like a year to 4 years, but I definitely have seen it in older ferrets who either have free roam around the house, they don't have an enclosure, or they have unsupervised time outside of the cage. Typically, the owner reports that they are not eating their favorite snacks. Maybe they're lethargic. When you do your physical exam, they're usually painful on abdominal palpation. And then the biggest thing that I think separates them from cats and dogs is that even if they have an obstructive foreign body, they may not always vomit. So in cats and dogs, usually we say, okay, well, if they're not vomiting, that's probably not obstructed. But in a ferret, you cannot make that assumption. Um, if you're lucky, the owners catch this really early and the ferret is still bright and alert, he's just not eating. If you're unlucky, this has been going on for a few days, and these guys can be really debilitated. Like they can be dehydrated to the point of hypovolemic shock and may require some pretty serious intervention. So, diagnosis of gastrointestinal foreign body is done the same way as it is in dogs and cats, just on x rays. If you are uncertain, you can certainly think about doing a barium study to do contrast and see if you can find the obstruction. Sometimes, whatever the offending object is very obvious. I'm going to show you a couple of x rays from our clinic of what that might look like. And then, treatment is generally surgical. There is some argument that some foreign bodies can move if you provide enough medical treatment. So, if you are providing enough hydration, IV fluids, pain medication, all of that, they may be able to pass the foreign body on their own. I would say 80% of the time we are having to go to surgery. But again, consider the fact that some of these guys come in severely dehydrated, they may be in shock, and they may require quite a bit of supportive care before they can go in and be a safe anesthetic candidate. So I'm just going to show you some x-rays of what that looks like. So in these x-rays, I think the foreign bodies are actually pretty obvious. So here, this guy ate the rubber off of the bottom of a piece of furniture, And he came in with a history of not eating for 4 days and was surprisingly okay. Um, we were able to go in and surgically remove that, and he did great after surgery, but definitely not something we would have tried to let pass on its own after 4 days. On the other hand, this kid was getting fed salmon with bones in it and had swallowed some of the bones. And this is actually quite a large piece that was in there. And it was causing a lot of distress. So the ferret was no longer eating, was very uncomfortable, but actually was able to move and pass on its own. So when you're dealing with kind of small foreign bodies, you may make the decision to medically manage. If you're going to do that, you need to take recheck radiographs every couple of hours to make sure things are in fact moving, keep them really well hydrated, keep them on good pain meds and good gastroprotectants. But generally speaking, like I said, we are going to have to go to surgery and remove whatever it is they decide to eat. This next disease is another reason why a ferret may present to you for a history of anorexia. So, Helicobacter mustelae is a bacteria specific to ferrets that is very similar to a bacteria that humans get called Helicobacter pylori, which is the bacteria that causes gastric ulceration. And they are actually used as the lab animal model for gastric ulceration in people because they get such a similar species of Helicobacter. It's a gram-negative rod. Most ferrets do already have it, unless they've been raised in isolation or they've been raised in a lab specifically to be exempt from Helicobacter. So all of your ferrets have the possibility of getting this disease and getting gastric ulcers even though they aren't clinical all the time. This is something that occurs a lot when they get stressed out. So if there's been a big change, if they've been sick from something else, then they are very susceptible to creating ulcers. The big things you might see with these guys, melena obviously is a possibility with, bad ulcers that are bleeding, you may see melena, but the biggest thing is usually anorexia. Sometimes they are nauseous and you can see hypersalivation or pawing at their mouth. But usually owners are just going to say, ugh, they just don't feel good, or they're having those tarry stools. And diagnosis of specifically Helicobacter is actually quite difficult. So the gold standard for this is actually a gastric mucosa biopsy. Obviously going to be a little bit out of the realm for quite a few of our clients and for our patients. You can also attempt a fecal PCR, but that can come back negative, or just keep in mind that all of these guys do, in fact, have Helicobacter. It's just a matter of is it causing the problem at the time. So, generally, we opt to diagnose this based on clinical signs and history. And if you get a ferret who's not feeling well, who's having vomiting and nausea and not eating, then keep this high up on your list. If you are suspicious of gastric ulceration, the treatment is very similar to other mammals, with kind of the caveat that because we know that they get Helicobacter and we know that there is a bacterial cause for gastric ulcers in this species, we do also add on antibiotic therapy. So the two that we generally use are amoxicillin and metronidazole, both dosed at 20 mg per kg by mouth every 12 hours. It's important to note that this should be given for the full 7-day course, even if the animal is feeling better, to make sure that you've taken care of the problem. So, even if you're treating the bacteria, you do still have to treat the discomfort. Obviously, if you are suspicious that you have gastric ulceration, nonsteroidal anti-inflammatories are contraindicated. So, you may consider something like gabapentin for pain relief, but don't give meloxicam or anything like that. General supportive care, sucralfate is recommended if you have true ulcers for 2 to 4 weeks. And it does have to be given either 30 minutes before or 30 minutes after other medications because it does create a coating of the stomach and that will affect absorption of everything else. So that's an important note. And then we do usually put them on a proton ion pump inhibitor, so something like famotidine or omeprazole. Famotidine is really only helpful in the first few days. So if you're still having clinical signs after 5 days, we do recommend that you switch over to omeprazole for a more long-term effect to keep them from creating more damage to that gastric mucosa. Ondansetron is becoming a lot more popular here in the US as an anti-nausea. Everyone was using Cerenia for a long time. It's important to note that Cerenia does not stop nausea, it just prevents vomiting. And these guys are kind of plus minus on their vomiting, but the ondansetron will keep them from having nausea because it actually targets the chemical trigger zone and keeps that from being active. So that's going to make them feel a lot better a lot sooner than Serenia would. And then remember that these guys probably aren't eating, they probably aren't feeling well. If they're dehydrated, do provide them with fluids. If they're just a little bit dehydrated, then subcutaneous fluids can be considered. But if they're really down and out, then you should consider placing an IV catheter and keeping them in hospital for IV fluids. And then hand feeding. If we have to hand feed, we usually use Oxbow Carnivore Care, but there are other hand feeding formulas out there, just depending on what's available to you. And we typically recommend feeding them at 15 milliliters per kilogram a few times a day. So we've covered two big gastrointestinal emergencies. I want to talk a little bit about insulinoma, which is very common in our older ferrets. Technically, the age of onset is between 2 to 8 years, but I would say we generally see this in the 4 to 8 year range rather than that 2 years. Um, it is a benign insulin producing tumor of the pancreatic islet cells. And basically, what happens is this tumor is just producing insulin to its own whims. It's not listening to anything. So, in a normal body, when you have a low blood glucose, you're going to turn insulin off so that the glucose can be in the blood and not in tissues. And in this case, the insulin is just doing its own thing and driving glucose out of the blood. So, you do suffer from severe hypoglycemia. Uh, and the clinical signs are going to follow that. It's going to be mostly neurologic signs. So, what we see most commonly is stargazing, nausea, ataxia, paraparesis, and in the really severe cases, we do see seizures. So, typically, what's going to happen is in your history, your owner is going to say something like, he doesn't seem to use his back legs very well sometimes, or I see him pawing at his mouth a lot, or he seems a little out of it after he plays really hard, or after he eats his sugary treat. And those are your red flags that you need to start looking for an insulinoma. Diagnosis can be a little bit tricky. In cats and dogs, we often do a paired insulin glucose. So if your insulin is really, really high and your glucose is really, really low, that's considered diagnostic for an insulinoma. In ferrets, we don't usually get that far. We usually just use a point of care glucose as long as you've ruled out other causes. So other things that can cause hypoglycemia are things like sepsis or starvation, liver disease, things like that. So you do want to run full blood work and just make sure there's nothing else going on. But if you're getting a point of care glucose that is less than 60 mg per deciliter with the clinical signs, then that can be very supportive of that particular diagnosis. The other thing you can do is do an abdominal ultrasound. Usually these tumors are pretty circumscript and you can see them on ultrasound. And then you can say, okay, for sure, I have something there that I'm very suspicious of. Treatment is two directions. So we can manage it surgically and we can manage it medically. So if you go the surgical route, like we said, these tumors are pretty easy to see and you can remove them via partial pancreatectomy. It is important to remember that even if you remove the tumor, it will come back. Recurrence is 100%, usually within a couple of years. But for that couple of years, you do get disease free time. So these ferrets are not having symptoms of hypoglycemia. They're not getting ataxic. They're not stargazing. And they maintain a really good quality of life. If you're going for medical management, then you're focusing more on making the animal more insulin resistant. So we use steroids for that. The steroid we choose is prednisolone, and that's because they are similar to cats, where they don't break prednisone down to prednisolone. So we just give them the prednisolone to start. Our starting dose is usually a mg per kg per day. So we do zero point 0.5 milligrams every 12 hours, and it's important that you keep them on a 12-hour schedule. And so it is a bit of a lifestyle change if you go with the medical management route because they do have to be switched over to a high protein diet. They can't have any carb rich or sugar rich snacks because that will cause them to make a lot of insulin and it'll tank their glucose. And they have to have lots of little snack stations around so that they are having a hypoglycemic event, then they can have a little snack and feel better immediately. Um, there are pros and cons, of course, to both versions of treatment. With surgery, you do get disease-free time, but it is expensive, and the post-operative period for 12 to 24 hours is pretty intense. They do have to be hospitalized. They will experience really big swings in their blood glucose, and they may have to be kept on a dextrose CRI for a little while until that balances out. Medically, it is a bit of a diminishing return, meaning that there will come a point where the prednisolone won't work anymore. We do have additional medications we can add on, such as diazoxide, but you will get to a point where nothing makes a difference. And these guys, can present in hypoglycemic crisis that requires restabilization with fluids and dextrose strips. But I think it's really important to tell owners that this is a terminal diagnosis. This will eventually reach a point where we can no longer management, no matter which direction they choose to go with it. The very last thing we're going to discuss for ferrets is urinary stones. This has become a very common presentation, especially in the last few years. Like in other species, it's usually more common in males because of the smaller urethra, but it can happen in males and females. 10 years ago, if you had asked what was the most common composition of a urinary stone in a ferret, we would have said struvite, which is a stone that forms usually secondary to infection because of basic urine pH. But recently, almost every stone that we pull out is a cystine stone. And there's a couple of reasons for that. The biggest one being a change in diet. It's technically not completely proven yet, but there's extremely high correlation between ferrets who are fed diets with pea protein in them and ferrets who make cystine stones. So if you are seeing a ferret for stones, then absolutely you need to talk to the owners about their diet and make sure that they are not feeding anything with pea protein in it because they are going to make more stones. So our big clinical signs here are hematuria, stranguria, and in those cases where they are blocked, they are going to have a hard, firm bladder, and it's going to be very painful on abdominal palpation. Diagnosis is typically by radiographs. So we are very lucky in that the two stones that they like to make are radio opaque, so you will be able to see them. Treatment can be a little bit on the complicated side because this is going to require surgery. But if your patient is blocked, then you have to unblock them and stabilize them before you can take them to anesthesia because they are going to have the same electrolyte derangements as a blocked cat. So they are going to have the hyperkalemia, the azotemia, all those things that make them a little bit riskier to take to anesthesia. So in the same way that you would handle a blocked cat, you're going to want to insert a urinary catheter, get those stones retropulsed out of the urethra and back into the bladder and make sure that you have a patent way for urine to escape, and then run them on fluids to try and get them a little more stable. So to get that potassium back down, to get that azotemia back down before you want to take them to surgery. The cystotomy, very similar to other species. Um, really not much there that you have to worry about from an anatomical point of view. There are some cases, just like in cats, who consistently block and reblock, where you might not be able to salvage the urethra, or there are stones that are too lodged and you can't get them out, in which case a perineal urethrostomy should be considered for these guys. So the big point I want to drive home here is that pea protein is strongly correlated with cystine stone formation. And if your owners are feeding a food with protein, with pea protein, get them off of that food as soon as you can. And then we are going to go through some x-rays and talk about some anatomical differences that are important when it comes to unblocking them. So the first thing I want to point out on this picture and these x-rays is the os penis of ferrets is actually J-shaped. So you can see here it's got a little bit of a hook on the end. And here you can see the tip of it here. So the urethra can be a little bit difficult to locate. It's just past this tip. That's where you want to insert your catheter. So if you ever have to do this procedure, keep in mind that it does look a little bit different than cats and dogs. The opening to the urethra isn't exactly on top of the penis. And this is two pictures of this ferret who had a very large stone. So this was not a urethral blockage, but just a very large bladder stone. So you can see here, it's very spiky. It's pretty much taking up the entire bladder. Um, and you can see them with stones all the way down the urethra. So when you're taking your x-rays, make sure that you are getting the entire back end so that you're not missing additional things, because there may not be anything in the bladder, but there will be things in the urethra. So just something to keep in mind, and some strange anatomical things that are specific to ferrets if you ever have to catheterize them. Most of the information for this lecture came from this book, Ferret, Rabbits, and Rodents, Clinical Medicine and Surgery by Dr. Quisenberry. Uh, Very highly recommend if you are planning on seeing exotic species in practice. It's a lot of good information and extremely helpful for just day-to-day things. But that is the end of my lecture. I hope everyone learned something, and thank you again for inviting me to talk with you guys. Really enjoyed putting this together, and if you do have questions, please feel free to reach out to me. This is my email, and I am happy to answer whatever might come up. And then I did include our clinic website as well. There's just a lot of really good educational things on there, lots of videos that we encourage other veterinarians to use if they are having trouble communicating things to owners. But I hope you have a great rest of your day, and thank you for listening.
Bom, muito obrigada, doutora, pela palestra, foi incrível. E, gente, eu gostaria de lembrar que quem não assinou a lista de presença, a gente abriu agora de novo, então corre lá para assinar, para não deixar de receber o certificado, tá bom? Queria agradecer a todos vocês que acompanharam aqui hoje e também toda a nossa equipe do GES. E eu gostaria de lembrá-los novamente sobre a nossa palestra, que vai acontecer na quinta que vem. Ela vai ser presencial, às 5h15 da tarde, e ela vai ser a nossa última palestra do mês de março, que a gente homenageou as mulheres. Então, a gente já colocou o QR Code aí, vocês já podem se inscrever, vai ser super legal, tá? E lembrando também, não esqueçam de seguir a gente nas nossas redes sociais e acompanhar todos os nossos posts e também todos os nossos eventos. Muito obrigada, gente. Boa tarde, boa noite.